So I'm here today with Dr Ashish Bhatia, and he's from Chicago, and he's going to tell us about the TheraClear and why it's fantastic to have this in your clinic. So thank you so much for taking the time today.
Oh, thanks for having me.
Lovely.
Appreciate it.
So tell us about it. Why it's such a great device?
You know, we've had the TheraClear in our practice for many years. It's really kind of a foundation of our medical practice, actually. When we first got it, you know, one thing we knew is we have a lot of acne patients in our practice. And, you know, they struggle because typically what we do when a new acne patient comes in, we assess them and we talk to them about skincare, but we usually start them on medications. And, you know, the medications are usually a topical and oral medication. And, you know, we counsel them appropriately to give them realistic expectations and tell them, look, you know, the medications take a while to work. You know, sometimes it'll take up to 3 months. So your acne will get better or worse, for the next 3 months, but then it'll eventually stabilize. And, you know, this is usually pretty upsetting to the patient and the mother, and, you know, because they want this fixed right away. And so we give them the option. We say, hey, look, you know, if you want to jumpstart the therapy, you have an option. You can actually go and have a treatment in our clinic, and it's a very nice treatment. It's painless. It just takes a few minutes, about 10, 15 minutes. And what it does is it clears out your pores. It kills the bacteria because it's got light that will kill the bacteria in there. And it really helps improve the skin, and it'll help improve the acne lesions. And within 1 to 2 treatments, you're going to see an improvement. Next question always is, what's 1 or 2 treatments going to take? We say usually we get a treatment today and then again in a week or 2. And by the time you get your second treatment, you'll see some results. And, you know, I'd say half of the patients actually go and say, oh, yeah, you know, this is something I'm interested in. Out of those, probably half of them will go ahead and try it. And the beauty of it is they're all happy because it really does start improving their skin and their acne right away. It actually helps the medications work better because when you clear out the pores, the topicals can actually penetrate better.
Oh, okay, so how does it actually work?
So I'm sorry?
How does it actually work?
The device, so there's 2 parts to it, and so the treatment is actually done with this little head, and this head is put on the skin, and you turn the machine on, and it's actually it's foolproof to use because when you do it, as soon as you get suction, you get a seal. That's when the device pulls the skin in, and it gently pulls all the stuff and junk out of the pores, and then while the skin is maximally stretched, and the light fires, and that, you know, just feels a little like warmth, and that's the light is what does the work. It kills the bacteria there. And it gets rid of any of the little redness or blood vessels that are around the area, and helps improve the acne. So it's very quick. You know, you do it, fire, do it, fire. So it's easy to learn for people that do it in the practice, and it's easy for the patient to tolerate because when the skin is actually pulled in, it has a numbing effect, and so you don't feel much. Yeah. The other interest, then there's a new handpiece I think that was approved a few months ago, and it's a new tip that goes in that actually has a needle, and it's the only device in the U.S. that's approved for cystic nodules.
Right.
So usually these patients need Roaccutane or Accutane, and a lot of patients don't want to take it. It's expensive, and there's a lot of monitoring that needs to be done, at least in the U.S. And so what this does is it stretches the skin, and there's a sterile needle, and the skin comes upon the sterile needle, and it pulls all the contents out of the deep cysts. So it's another benefit for those patients with more severe acne.
And can you use it on the back as well?
Yeah, you can use it on the back. So the main areas we use it is face and the back. Yeah.
Okay.
Yeah.
Great.
Yeah.
All right. Well, thank you so much for taking the time to talk to us today.
It was my pleasure. I hope it helps your viewers and your patients.
Lovely. Thank you. So if you've got any questions or if you want any more information about the TheraClear, just drop us an email at info@plasticsurgeryhub.com.au.